Welcome to the Competency Training Series for Direct Care Workers, presented by Silver Home Care. Today's topic is Universal Precautions. Universal precautions are a set of critical infection control practices designed to protect caregivers and their clients from the transmission of infectious diseases. As direct care workers, the health and safety of our clients and ourselves are of utmost importance. Each one of us has a crucial role to play in preventing the spread of infections, and our key weapon in this battle is knowledge. Universal precautions are not just principles to remember, but a way of life for us in our caregiving roles. By the end of this session, you will have gained a basic understanding of each principle and how to apply them in your daily practice. Principle 1. Treat all bodily fluids as potentially infectious. The first and foremost principle is to treat all bodily fluids as potentially infectious. This concept lies at the heart of universal precautions. It might be easy to fall into complacency, especially when a client appears healthy or shows no visible signs of illness. However, many infectious diseases can be asymptomatic, meaning the person infected may not show any signs of being unwell, yet they can still transmit the disease. This is why we must always regard all body fluids, from all persons, at all times, as potentially infectious. It includes not just blood, but also other body fluids such as urine, saliva, feces, sweat, vomit, nasal secretions, and even breast milk. By consistently applying this principle, we create a barrier that prevents the spread of potential infections, protecting both ourselves and our clients. Principle 2. Utilize protective barriers. Our second principle involves the utilization of personal protective equipment, more commonly referred to as PPE. PPE acts as our primary line of defense against potential infections. It includes items like gloves, face masks, face shields or goggles, and gowns or aprons. However, merely wearing PPE isn't enough, it's about wearing them correctly and at the right times. Principle 3. Strict hand hygiene. Hand hygiene, the third principle, is one of the simplest yet most effective ways to prevent the spread of infection. It's not just about washing your hands, but doing it correctly. This involves wetting hands with water, applying enough soap to cover all hand surfaces, rubbing hands palm to palm, and cleaning in between the fingers, the backs of hands, and the base of the thumbs. Pay particular attention to the fingertips and under the nails, as these areas can often be missed. Scrub for at least 20 seconds, roughly the time it takes to hum the Happy Birthday song twice, and then rinse thoroughly under running water. Dry hands completely, as damp hands can attract microbes. Remember to perform hand hygiene before putting on gloves, after removing gloves, and any time your hands might have come into contact with potentially infectious material. If soap and water are not immediately available, alcohol-based hand sanitizers with at least 60% alcohol can be used as an alternative. Principle 4. Sharps. As a direct care worker, it's imperative that you avoid handling sharp objects, known as sharps, which can include items like needles, syringes, and lancets, unless they are found where they pose an immediate hazard. In such situations, always steer clear of touching the sharp end and ensure you're wearing gloves. If a sharps container is available, use it for disposal of the sharp object. However, if a container isn't readily available, temporarily store the sharp in a sturdy plastic container with a screw-top lid, such as an empty peanut butter jar or detergent bottle. Seal the container and clearly label it as sharps. Do not recycle. Do not dispose of this container in the trash. Instead, notify your supervisor of the situation promptly for further instructions. Lastly, after handling sharps, safely dispose of your gloves and wash your hands thoroughly with soap and water. By adhering to these precautions, you can ensure safe handling and disposal of sharps even when a designated sharps container is not within reach. Principle 5. Clean and disinfect surfaces. Our fifth principle is about maintaining a clean and safe environment. Surfaces that we come into contact with can often serve as reservoirs for disease-causing microbes. Regular cleaning and disinfection of these surfaces are crucial in preventing the spread of infections. This includes high-touch surfaces like countertops, bathroom fixtures, medical equipment, doorknobs, and light switches. Use a disinfectant that's effective against a broad range of pathogens, and make sure to follow the manufacturer's instructions for use. The process usually involves cleaning the surface with soap and water first to remove visible dirt, and then applying the disinfectant. Cleaning isn't just about the physical removal of dirt, it's also about reducing the number of microbes to a safer level. Principle 6. Follow good respiratory hygiene. Principle 6 involves good respiratory hygiene. Infections can also spread through droplets produced when an infected person coughs or sneezes. To prevent this, always cover your mouth and nose with a tissue or the inside of your elbow when coughing or sneezing. Encourage your clients to do the same. Dispose of tissues immediately in a lined trash can, and wash your hands afterwards. Wearing a mask can also reduce the spread of respiratory droplets. Good respiratory hygiene isn't just about protecting ourselves, but also about preventing the spread of infections to others. Dispose of waste properly. Dispose of contaminated waste, including used gloves and tissues, in lined trash receptacles. Ensure proper sealing of bags and adhere to regular disposal practices as per local guidelines. By adhering to these universal precautions, you play a vital role in preventing the spread of infections and creating a safer environment for both yourself and the individuals you care for. This concludes our training on universal precautions. If you have any questions or require further guidance, please don't hesitate to reach out to your supervisor.